I want you to try and visualize something for a second. Uh, Imagine you're holding a standard, everyday 4-inch rubber band,
Okay. Yeah, got it.
right? So you've got it in your mind. Now imagine grabbing both ends and pulling that 4-inch rubber band until it stretches out to like 12 inches.
Oh, wow. Yeah, that's a
You can
shame.
practically hear it straining, right? Like you can see the rubber getting thin, almost translucent and just vibrating with all that stored tension.
Right, right. It's right at the breaking point.
Exactly. Now keep holding it there in your mind because that extreme, I mean, almost impossible stretch is exactly the kind of biomechanical stress the human pelvic floor endures during childbirth.
It really is. It's a massive amount of physical trauma.
It is. And welcome to today's deep dive, everyone.
Yeah.
We are digging into the source material today to answer a question for you that honestly rarely gets talked about openly. We're looking at whether that specific childbirth nerve stretch can actually affect vaginal grip and physical sensation.
Yeah, and the clinical data we have on this is universally recognized. I mean, we've got a whole stack of sources here.
Yeah, we've got everything today.
Right, spanning from foundational anatomical textbooks like Stat Pearls, all the way up to strict clinical guidelines from NICEA, the National Institute for Health and Care Excellence, and the Royal College of Obstetricians and Gynecologists.
And mother love and caring medical, it's a lot.
It is. But to understand the sheer physics of what happens to vaginal grip and sensation, we first have to map out the specific anatomical hardware involved.
The hardware, right.
Exactly. And the primary conduit for all of this is the pudendal nerve.
The pudendal nerve.
Right. So it originates deep in the pelvis, branching off from the sacral spinal nerves, specifically the S2, S3, and S4 roots.
Which are like situated right down near your tailbone, right?
Yep, exactly down there. And from there, it takes a rather complex winding route. It travels through a very narrow, tight tunnel of connective tissue known as Alcock's Canal.
I noticed in the clinical texts, actually, that the name pudendal derives from the Latin word pudendum,
Yes.
which literally translates to parts to be ashamed of, which is just wild to me.
It's wild, yeah. The historical stigma surrounding pelvic anatomy is just baked right into the medical terminology.
I mean, that's a major reason why so many people just suffer in silence,
Yeah,
rather than reporting a loss of sensation.
absolutely. But functionally, this nerve is the master control cable for the entire region. It's a mixed nerve,
I mean, what exactly?
meaning it carries sensory, motor, and autonomic fibers. So it commands the pelvic floor muscles, it controls your urinary and anal sphincters,
Yeah.
and it provides the primary sensation to the clitoris as well as the lower fifth of the vaginal canal.
Wait, hold on. You're telling me that this single nerve commands the muscles, the sphincters, and all that sensation?
All of it.
And it is sitting right in the blast zone of a vaginal delivery.
Literally right in the path, yes.
Yeah. Because when the baby's head descends through the birth canal, the innermost muscle wrapping the vagina, the pubococcygeus muscle, is forced to stretch up to 3.3 times its resting length.
3.3 times. Just think about that.
That is the 4 inches to 12 inches stretch on our rubber band analogy. So how is it biologically possible that the nerve embedded in that tissue doesn't just, completely snap under that much strain?
Well, nerves do have a very specific physiological tolerance for stretching, and while they rarely sever completely during birth, they undergo a profound level of microtrauma.
Microtrauma.
Right. Think of the nerve not as a single solid wire, but as a cable bundling thousands of tiny So when you stretch that pubococcygeus muscle to 3.3 times its length, you are pulling those bundled axons far beyond their safe mechanical limit. The structural integrity of the nerve's protective casing, the myelin sheath, gets warped and completely frayed.
So it's like taking a high-speed fiber optic cable and stretching it until the glass fibers inside start to fracture.
That's a perfect way to look at it, yeah.
Like, the cable is technically still in one piece, but the electrical signal is going to be weak, or static-filled, or intermittent.
Exactly. The electrical conductivity is deeply compromised, and this structural stress translates into trauma through two distinct mechanisms, traction and compression.
Okay, let's unpack those. Traction is a pulling force, right?
Right. So imagine a prolonged pushing phase of labor or, delivering a particularly large baby. The nerve is being literally overstretched. It's pulled taut around the ligaments and bones of the pelvis.
Ouch. And compression.
Compression is a crushing force. This occurs from the direct, prolonged pressure of the baby's skull resting against the maternal pelvic bones, or from the use of instruments like forceps.
Oh, because the forceps physically squeeze the nerve within that tight space of Alcock's canal.
Precisely.
So if the nerve is taking on that much pulling and crushing damage, how does that translate into the physical loss of grip for you listening? Like, what's the actual mechanism there?
Well, the pudendal nerve is directly responsible for the motor function of the levator animuscles.
And those form the muscular sling that supports the pelvic organs, right?
Yep, and they surround the vaginal canal. So when the nerve is damaged by traction or compression, the brain sends an electrical signal telling those muscles to contract. But the fractured fiber optic cable can only deliver a fraction of that voltage.
Ah, a weak signal directly leads to reduced muscle recruitment.
Exactly. The muscles simply cannot fire with their normal intensity. And that results in a weakened vaginal grip, a feeling of internal fullness or heaviness, and just a major decrease in physical responsiveness.
I actually saw a study in our sources today from the European Journal of Midwifery that mapped this out practically.
Oh, right, that study.
Yeah, they noted that robust pelvic floor musculature is strongly required during sexual intercourse. So, when the hardware is compromised, the function naturally declines.
It has to, yeah.
Patients report decreased sexual sensation, pain during intercourse, which the source is clinically called dyspareunia or anorgasmia,
Yeah.
the inability to achieve orgasm.
Right, because the nerve just can't deliver the sensation to the brain, and it can't deliver the motor command back down to the muscles. It's a two-way failure.
It really is.
And when you look at the compression aspect, the loss of sensation can sometimes shift into something far more severe.
Like what?
Well, with severe or prolonged compression, the nerve doesn't just go numb, it becomes inflamed and hyperreactive, developing into pudendal neuralgia.
Neuralgia.
This neuropathy causes just agonizing burning, shooting, or stabbing pain throughout the lower pelvis.
Is that essentially like when you sit on your foot weird and it falls asleep, but on a much more permanent and painful scale?
Not quite. I mean, when your foot falls asleep, you're usually just temporarily compressing a nerve, right? And the tingling passes the moment you shift your weight.
Right, you shake it out.
Exactly. But pudendal neuralgia involves structural inflammation that doesn't just fade when you stand up. The sources describe one very distinct hallmark symptom.
What's that?
Patients often report the exact sensation of sitting on a golf ball or a tennis ball lodged inside their pelvis.
Oh, my God.
Right. Imagine trying to drive your car or sit at your desk at work with the constant, unavoidable pressure of a rigid object pressing upward into your pelvic floor.
That sounds absolutely miserable.
It is.
And the texts mention that people with this specific golf ball sensation often find their only relief when they go to the bathroom and sit on a toilet seat. Which sounds so strange at first.
It sounds strange, but biomechanically it makes perfect sense. Think about a standard flat chair. It puts upward pressure directly on the pelvic floor, right where that inflamed pudendal nerve is entrapped.
Right.
But a toilet seat has a cutout in the middle, so when you sit on it, your body's weight is shifted outward onto your sit bones. Or ischial tuberosities, clinically?
Ah, so it completely removes the direct upward mechanical pressure from the inflamed nerve.
Exactly, offering immediate, though, temporary relief from that golf ball sensation.
Wow. Okay, so if a person is dealing with a weakened vaginal grip, feelings of looseness, and a nerve that is really struggling to send signals, the instinct and, frankly, the advice printed on every single postnatal pamphlet is to just do a million Kegel exercises.
Yes. Everyone says do your Kegels.
Right. You have a weak muscle, so you repeatedly contract it to strengthen it.
Yeah.
But the sources we're deep diving into today reveal that standard Kegel advice might actually backfire completely.
It can absolutely backfire. To understand why Kegels can be the absolute worst thing you can do in this scenario, we have to look beyond the muscles and the nerves and examine the skeletal structure and hormones.
The hormones.
Yeah. During pregnancy, the body floods with a hormone called relaxin.
Oh, I've heard of that.
Yeah, its sole purpose is to relax and loosen the tough, fibrous pelvic ligaments so the pelvis can physically expand and allow the baby's shoulders to pass through.
Right, so the ligaments act like the hinges of the pelvis. If the hinges are loose, the whole frame is wobbly.
Spot on. And after birth, many people experience what is called ligament laxity. If those ligaments don't naturally tighten back up as the relaxin leaves the system, the entire pelvic structure remains fundamentally unstable.
Okay, so you have a wobbly pelvis.
Right. and your central nervous system is highly attuned to this instability. To try and hold your wobbly pelvis together, it forces the pelvic floor muscles into a constant chronic state of spasm.
Oh, wow.
They're clenching overtime, 247, just to keep your skeletal structure upright.
Wait, let me make sure I'm visualizing this correctly. If your pelvis is unstable due to loose ligaments, your pelvic floor muscles are essentially locked in a perpetual cramp to compensate.
Yes, they are acting as a splint.
So if you follow the standard advice and try to do Kegels, which means voluntarily clenching those muscles even more, you're telling a muscle that is already spasming to work harder.
Exactly. The source from Caring Medical highlights this exact mechanical failure. If you attempt pelvic floor muscle training on muscles that are already in spasm and they lack a stable ligament base to pull against for resistance, you generate significantly more pain and dysfunction.
You're just throwing gasoline on the fire.
Pretty much. You are exhausting a muscle that is already crying out for relief, and you are putting further strain on an already damaged pudendal nerve.
That completely flips the script on how postpartum recovery is usually talked about.
Mm.
I mean, if a traditional Kegel is just, worsening a spasming muscle, how does someone actually fix a weak vaginal grip without doing more damage?
Well, the clinical guidelines from NICE stress that rehabilitation must be individually tailored by a specialist rather than relying on generalized pamphlet advice.
Right. So you can't just guess.
No. You need a pelvic floor physical therapist to physically assess whether the muscle actually has the ability to relax before you ever ask it to contract.
Okay, that makes sense.
The path to recovery requires a highly targeted, multi-tiered approach. The first pillar is advanced pelvic floor physical therapy.
And what does that look like?
A specialized therapist will use internal and external myofascial release to manually calm those spasming muscles, and they also utilize biofeedback.
Okay, I saw biofeedback in the materials. How does that actually work in practice? Is the patient just looking at a monitor?
Essentially, yes. Sensors are placed to monitor the electrical activity of the pelvic floor muscles, and the patient watches a screen that displays a visual representation of that activity.
Why do they need the screen?
Because the nerve damage has broken the standard brain-to-muscle connection. The patients often can't even feel if they are contracting or relaxing.
Oh, wow.
Yeah, so the screen provides real-time visual data. It allows the brain to bypass the damaged sensory pathways and use visual cues to relearn how to properly command the muscle.
That's incredible. Now, the clinical overviews also detail the use of 10NS therapy, transcutaneous electrical neuromuscular stimulation.
Yes, 10NS.
They specify using a 10 hertz frequency for 30 minutes at a time. What is that specific frequency actually doing to the tissue?
It's fascinating. The goal of the electrical stimulation at that specific 10 hertz frequency isn't just to make the muscle twitch. It serves a dual purpose.
Okay.
First, it neurologically re-educates the pudendal nerve, coaxing it to transmit signals along its damaged pathways by providing a rhythmic electrical template.
It's giving it a rhythm to follow.
Exactly. And second, it intentionally fatigues the spasming muscle fibers. By forcing the muscle to rhythmically contract and release, it depletes the local neurotransmitters causing the spasm, allowing the muscle to finally relax and reset its resting tone.
So that addresses the neurological and muscular side? But there's also the physical tissue itself, right?
Right.
Because the sheer stretch of birth alters the actual density of the vaginal walls. This is where the Mother Love sources detailing specific collagen treatments come into play.
Yes, the collagen aspect is crucial.
They reference products utilizing type 7 collagen-unique treatments. And specifically, they formulate with types I and 3 recombinant collagen.
Right. Recombinant collagen is synthesized to mimic the exact amino acid structure of human collagen. After childbirth, that extreme physical stretch depletes the natural collagen density in the vaginal walls.
Because it was stretched so thin.
Exactly. Now, type I collagen is responsible for structural tensile strength, while type 3 provides elasticity and pliability. These treatments are applied to restore basal cell vitality.
Basal cells, remind me what those are.
Basal cells are the stem cells at the deepest layer of the tissue that regenerate new skin and mucosal layers. So by rebuilding the collagen matrix in the mid to posterior vaginal canal, these treatments directly target the loss of internal firmness.
I see.
They restore the physical wrapping sensation and the structural components of vaginal grip.
So it's like if the collagen matrix is the topsoil of a root system, the physical stretch of birth is like a landslide washing all that nutrient-dense soil away.
That's a great analogy.
You can't just expect the root system, the pudendal nerve, to thrive and send strong signals in empty space. The collagen treatments are packing dense, firm soil back around those exposed roots.
Right. You're restoring the environment.
Once the physical environment is secure, the roots can actually conduct signals again. You need both the structural density of the tissue and the electrical firing of the nerve to rebuild the grip.
Spot on. And beyond the clinical treatments, the Nice Knee guidelines recommend a highly practical lifestyle intervention that is crucial for allowing all of this healing to take place.
And what's that?
Managing constipation.
Ah, right, because the simple physics of straining to use the bathroom forces the pelvic floor down.
Exactly.
If you are bearing down hard, you're putting immediate mechanical traction and stretch right back onto a pudendal nerve that is desperately trying to heal. You are essentially like pulling on the scab every single day.
Every day. It forces the pelvic organs downward, stretching the pudendal nerve all over again. If you don't remove that daily mechanical stress, the nerve just cannot maintain the continuous cellular repair needed to restore its myelin sheath and axonal integrity.
That makes so much sense. So we set out to answer a very specific question for you listening today. Can the physical nerve stretch of childbirth fundamentally alter vaginal grip and physical sensation?
And the literature is unequivocal.
It really is. Your pelvic floor muscles are forced to stretch over 3 times their normal length. This causes immense traction or compression to the pudendal nerve, the master cable commanding those muscles.
Right.
When the nerve is damaged, the signal weakens, which directly diminishes vaginal grip, creates feelings of internal looseness, and dampens sexual sensation.
But the most important takeaway from diving into these sources is that this isn't just an inevitable consequence of childbirth that you have to silently endure.
Absolutely not. By ignoring the blind generalized advice to endlessly clench spasming muscles with Kegels, and instead pursuing targeted neurological physical therapy combined with structural tissue recovery, the body's biomechanics can be repaired.
They really can. And, we spent a lot of time discussing how pudendal nerve damage results in a loss of sensation, numbness, or the burning pain of neuralgia.
Right.
But as a final thought on the sheer, unpredictable complexity of the human nervous system, the literature documents one incredibly rare, bizarre outcome of this nerve trauma.
Oh, and they're going to say.
Yeah. Sometimes when the pudendal nerve is damaged and begins to misfire, it doesn't shut down. Instead, it triggers a condition known as persistent sexual arousal syndrome.
Wow.
The damaged nerve gets stuck in the on position. It broadcasts a constant, intense, and entirely unwanted sensation of physical arousal that has no connection to actual psychological desire.
That is just insane.
It leaves the patient with a relentless electrical storm and no physiological way to turn the signal off. It's a strange, counterintuitive reminder of just how complex and powerful the human nervous system truly is.
It really is. It's been an eye-opening deep dive today. Thanks for exploring it with us, and we'll catch you on the next one.